This couple was consulting me, and I had consulted them about 8 months back. And when I did a transvaginal sonography, she had an endometrial polyp, and they had come to me for childlessness. I told them, well, you have an endometrial polyp there, and unless we remove the endometrial polyp, we won't be able to carry on with your treatment for fertility, because after all, the pregnancy is going to settle down in the uterus, and there exactly in the inner lining of the womb, you have a polyp there. They were asking me the reasons of having an endometrial polyp. I said, well, this could be an hormonal aberration, or it could be because of infection, or probably we really don't know why an endometrial polyp is developing in your case, and idiopathic endometrial polyps are pretty common. So we planned it up and we went ahead and did a polypectomy, doing a hysteroscopic polypectomy, for which she just got admitted in the morning at 8 o'clock. The procedure was over, and by afternoon 2 o'clock she was home. The procedure was very simple. The endometrial polyp was seen hysteroscopically, and a proper bipolar resection was easily done. Subsequently, we just lost her for follow-up, and she was taking treatment with various places, and she was just not getting pregnant again. Somebody later on again found that she has one more endometrial polyp, and she was again surprised that she has developed a polyp again. And she went ahead and did a polypectomy at that place as well. During that, they have not used a resective method, but they just did an endometrial curettage and took out all the material outside. Probably that's also one of the ways to managing patients of endometrial polyp, especially you have lots of polyps, endometrial polyposis or polypoidal endometrial hyperplasia are there. She did not get pregnant further, and she landed up at our place again. And when I looked at her, I said, well, your endometrial cavity appears to be very, very good. There is no more polyps now, but I suspect that you could be having less amount of bleeding, because I am seeing the endometrial thickness not achieving its target zones. She said, yes, ever since the last curating was done, I am not having a regular amount of bleeding. I was bleeding earlier about 3 to 4 days, but now I hardly bleed for 2 days. And there it was. We suspected that she could be having some intrauterine adhesions because of a curating operation done for her. Went ahead again with a hysteroscopy, and she had quite a bit of thick adhesions in one part of the uterus. The adhesiolysis was done with simple scissors. Intra-endometrial or subendometrial PRP treatment was given. She was given a balloon dilatation. We put some hyaluron around that so that the adhesions do not form again. And we gave her a high doses of estrogen for a period of 1.5 to 2 months. And then she could develop a good amount of endometrium, and we went ahead. The question is, why do endometrial polyps develop again and again? And one of the main reasons of development of endometrial polyp, though it is idiopathic, it could be iatrogenic. If you are receiving treatments again and again, and especially if you are receiving loads of estrogen tablets again and again, or the infection is not treated completely, there is a possibility of reappearances of endometrial polyps. In this particular case, it was not the polyp which was reappeared. It was basically the whole endometrium had become polypoidal, for the earlier doctor had done a complete curettage. But unfortunately, that gave rise to development of some adhesions, and because of which we had to do an adhesiolysis and go ahead and manage it further. Thank you.